Hi, I'm Sam Firoozi. I'm a consultant cardiologist working at HCA, and I specialize as an interventional cardiologist. It all started during my teenage years. My mother was a cardiac nurse, and so she would always come home and tell us stories about her work, and obviously with the cardiac angle, it generated a subconscious interest in cardiology and medicine in general. And then as I trained in medicine and became more senior, I started to realize that cardiology is a great specialty, both in terms of a mixture of hands-on procedures and surgical skills, but yet having the physician aspect and the medical aspect. So it's a real sort of hybrid overlap of the two, and that's what appealed to me. And I guess that's the reason why I ended up doing cardiology, and in particular interventional cardiology. I think the patient contact, I've always been somebody who's been comfortable being with people, communicating, working either in a team or in partnership with people. And so that aspect of the job, the patient contact, is something that I find very appealing and rewarding. Also, cardiology is one of those fast evolving areas of medicine with lots of research, lots of industry support, and especially within interventional cardiology, it's also very hands positive. There's a lot of evolving technology, and I've always generally been good in terms of manual dexterity and in terms of hand skills. So that's enabled me to become good at what I do, which is a very procedural subspecialty. Also, we tend to see, sometimes instant and sometimes rewarding and quick results, and I find that gratifying and nice. So those aspects certainly appeal to me. I try and deliver a one-stop service, and that would generally entail a comprehensive consultation where the patients are listened to, their history is taken in detail, they have the opportunity to share their symptoms, their concerns. We try and preempt, if possible, the consultation by organizing the relevant baseline investigations either beforehand or at the time of the consult, so that we have as much information as possible to either reach a diagnosis or to formulate an appropriate management plan. And then at the consultation or just after, what we try and do is put in place timely and rapid diagnostics to, as I said, reach a diagnosis and offer treatment. And it's all done through an efficient PA service with my personal assistant, Paula. And we're well supported in terms of working within the Harley Street Clinic, where there's all sorts of expertise at the hand. And if patients require invasive or complex interventions, then we can schedule that in a timely fashion. The final thing is that we do our best to put out correspondence in a timely fashion so that the referrers and the patients receive copies of letters and reports, within 24 to 48 hours maximum.